Okay, the next question is, what qualities make a good nurse and why? I said, I believe that I am going to be a good nurse because, my ability to be empathetic towards others. I'm able to adapt and I spoke about my role again, and my role is a case management assistant. And I said, I'm able to adapt, and as a part-time case management assistant, I am often filling in for another person and thrown into whatever unit they work on a regular basis. I said, I am responsible. I always make sure to follow up on any referrals sent throughout the day to ensure all my tasks are completed before leaving that day. I am punctual at my current job. I make sure to arrive 15 to 20 minutes early so that I'm able to get things done. Things ready for the day and see which patients will be discharged from the unit. I am a team player in my role. I have to coordinate with physicians, facility liaisons, case managers, nurses, physical and occupational therapists to ensure a safe patient discharge. I pay attention to detail. I have always been a perfectionist. My current supervisor stated in my review that out of 345 referrals sent that month, I had less than a 5% error. And last, I am a great communicator as this is a part of my role. So the next question is, if you have a conflict with a professor, how would you handle it? Okay. So this is what I said. I would try to be mindful and respectful of my professor because they are there to help me improve. You want to make sure that they know that you're not going to be here just blaming the professor for everything because, they could just be having a bad day. I would try to voice my disconnect in a polite manner using a calm tone. Emphasize. I would reiterate that I am sure this is a misunderstanding and that I would never believe they would intentionally try to cause me any kind of grief. Most importantly, I would implement my communication skills, there's that communication again, to get my point across, but also listen to understand what could be causing this conflict. Okay, the next question. How would your classmates describe you? I have always been labeled as a caregiver because I am the first to offer assistance when available, or when able. My classmates have mentioned that I am reliable and a great team player. If you saw a medical professional acting unethically, what would you do? So this is how I answered this question, the one about the unethical thing. I said, if I saw a medical professional acting unethically, I would first try to get more information on the situation. Always say that, like you're going to get all the information you need. I would first try to get more information on the situation to understand why they would be acting unethically in the first place. If the action was toward a patient or coworker, I would try to talk with said person to see what could have led up to this. Most importantly, I would try to understand the medical professional and get the full details before taking any further action. Once I had all the information, I would provide advice on how to go about the situation in an ethical way and try to come to an understanding or ethical solution. I ran into a similar situation and then talk about something that maybe, a classmate, maybe somebody asked you to cheat or to lie and it was unethical. So talk about that and then say, what you did and then what you learned. This one I wasn't asked either, but I saw a lot of other people post videos about this question. So, what about being a nursing student intimidates you most and why? So, I guess I'm most intimidated about clinicals because this is something I have no experience with whatsoever. I am most nervous about overthinking a process, but I know that this program will provide me with the necessary tools to overcome my challenges. Sweet, simple, and to the point. So, the next question. What nursing skills appeals to you most and why? So this is kind of like the what qualities, what are your good qualities that would help you in nursing or whatever. So I put the skill that appeals most to me is being able to adapt with ease because this is something I have been able to implement in my everyday life. Being able to adapt is such an important skill to possess as it allows you the ability to be put in anywhere at any time and perform. I have improved on this skill in case management because I am constantly floating to a different unit on a daily basis. This has allowed me to jump right into whether it be the ICU for patients with brain and spinal injuries that require greater length of stay, or orthopedics with hip surgery being discharged to a skilled nursing rehab for short-term therapy. The next question that I have written down is, if you were treating a patient who speaks a language you don't, what would you do to ensure good communication? Boy. Since English is my second language, obviously, if English is your first language, I would just skip that part. So I can understand the challenges of treating a patient that speaks a different language. You could say, if English is your first language, growing up in an atmosphere where I had other, I was surrounded by others that English wasn't their first language, I can understand the challenges of treating a patient that speaks a different language. You could always word it like that too. However, due to my time spent I put France and Italy because that's where I traveled abroad. I have learned how to properly communicate. Again, you could say, however, due to my experiences with different ethnic groups or activities that I did with people from different cultures, I learned how to properly communicate. So you could talk about, I would try to do the hand signals and try to get common words and then until an interpreter could arrive. So the next one, can you describe a nursing industry trend that caught your eye? Ooh, why does it interest you? So this is what I put. A nursing industry trend that caught my attention was increased specialization in different areas of medicine. So I kind of came up with this when I looked at the curriculum of the school, and it was oh, you're going to do psychiatric medicine, and then you're going to do geriatric and all that other stuff like that, pediatrics as well. So I was like, okay, that might get me some bonus points. So it says, the one that I have experience with, and then again, talk about your experience. So the one that I have experience with is the diabetic educator at my hospital. Basically, their task is to assess and educate newly diagnosed patients. They also provide them with extra medicine, medication, and slash scripts and information to ensure they understand how to properly care for themselves. I have also seen nurses be education coordinators, in which they are responsible for implementing and training new nurses on procedures, protocols, and processes. Tell me about a time you made a mistake. How did you handle it? I'm going to be honest with you here on this one. Don't talk about an actual mistake that was horrible on your part. So basically, so while volunteering at my nursing rehab, I made the mistake of taking a patient to the wrong side of the cafeteria. While this may not seem as a big deal, it could have been because the resident that I was helping care for had dementia, and something as small as this could have caused them major distress. When I realized my mistake, I quickly moved the patient to the correct side of the cafe and made it a point to ask for assistance to make sure I would avoid this error in the future. I was given a list with the residents' names, where they sit, and which cafe they eat at. From this experience, I learned that it's okay to ask for help when needed. We're interviewing more applicants than we could admit, and that's basically every nursing school. Why are you the best candidate? This is where you sell yourself. Literally. I am the best candidate for this school because in all that I do... Alright guys, so this is kind of these next few questions are going to be really repetitive because they kind of all say the same thing. And I'm going to give you my own experience to how I implemented this. So basically what I did, because I knew that some way, somehow, they're going to ask you, why this school? Why would we choose you? What's your personal care philosophy? So this is how I answered all of those questions. Because they might give you one of them, but in a different type of wording or with different wording. So basically, I went on their website and I looked up what their qualities are, what they stand for, what are their goals and what do they stand for. And I implemented it into a personal statement that I used to base my care around, like how I would care for the population that I'll be serving. So I put, I am the best candidate for this school because in all that I do, I strive to perform with integrity. Integrity is one of their things, and respect towards others. Integrity, respect. Those are the two key words. To meet excellence. Excellence is part of their mission statement as well. So I put, to me, excellence is working toward a healthcare reform that is both inclusive and diverse. Diversity is a big thing for them too. It's listed on the website. Most importantly, I believe nursing is all about being innovative and ensuring a better tomorrow for all. Innovation was also on the website. So that's how I would answer that question. The next question is the same thing, it's just worded differently. What is your personal care philosophy? This is what I said. I strive to provide care with integrity and respect towards others. It's literally the same thing, but just a little bit different wording. So they're going to ask you, why this school? Tell them your views and your goals align with the school. Talk about the curriculum. Talk about something that makes you want to go to that school and makes them be like what if you were introducing yourself to someone? Or what if somebody wanted to befriend you? What would be the things that you want to hear? And you got to be honest. Don't lie. Definitely don't lie. If that's not what you feel, then don't say, oh, my values align with your school. Talk about the curriculum or talk about an experience that kind of aligns with what they stand for, something in that sense. So at the end, they're going to say, so we've concluded the interview portion. Do you have any questions for us? Yes, always have questions, at least 2. If there's 2 people, have 2 questions. If there's 3 people, have 3 questions, so that each can answer a question. So these are 2 general questions that are never going to get you wrong answers, and they're not going to be mad at you for asking, and they're going to be very happy that you even asked questions. So I said, what is the biggest challenge students face in this program? What do I need to do to be ready to overcome or avoid it? That was one question. The next question is, in your experience, what do your most successful nursing students have in common? They're going to love that. I'm going to conclude this video by saying, good luck. Don't stress it. You're going to do great. I would recommend watching videos that give you more questions that could be asked and advice on how to answer them. I personally watched tons of videos the night before. I recommend you prepare ahead of time. But I'm the person that speaks from the heart, so I can't just have things I can't have things just ready to go. But I did it anyway, just to have something to talk about, just in case that the question was thrown at me and I really had no idea what to say. Just remember, if you aren't accepted, it's not because you're not good enough. Getting the freaking interview to begin with is an accomplishment, and if you weren't accepted into this program, it just could be that another door is opening up for you. So if you guys have any more questions or need help on anything, just, leave a comment down below on my video, and I'd be very happy to answer anything. I'm actually getting ready to start my program in January, so I'm going to be uploading my next video about what, nursing essentials are, so you can kind of get a basis for what you might need. If you need a minute, say, can I just take a minute to answer this question? Or please give me a minute to answer this question. Or can you repeat the question? Or whatever it may be. You only got 6 questions to answer, so make them count. Alrighty, everyone. Goodbye. Till the next video.